panel discussion which is about innovation in healthcare ecosystem. And we're jumping right in without any further ado. And I have to tell you, one of our panelists had to leave because his check-in time is at 12:30 and he had to rush. We apologize for that. Mr. Karthik Rajagopal won't be able to join us here. But we have the rest of the panel here, and presenting to you first our moderator, Mr. Senu Sam. He is the founder of Mykare, which is focused on making healthcare journey seamless. Welcome, Senu. Joining him on stage as the first panelist is Mr. Ajay Arora, Vice President of Strategic Planning and Projects with Hero Enterprise. That's not you, yes. Welcome, sir. Mr. Pradeep Palazhi, co-founder, president and CEO of ThinkBio.Ai, a company which is focused on solutions for biotech, pharma and healthcare sectors. Welcome, sir. And finally, Dr. Navin Gnanasekaran, who is the head of clinical services for radiology and interventional radiology with Apollo Hospitals, an expert in medical administration and mentorship. Over to you, Senu.
Good afternoon, everyone. I'm Senu Sam. I'm building Mykare Health. Something similar to Airbnb. We help small, medium hospitals to get more footfalls and more revenues. So I thought I'll take a quick introduction from my side to pitch my startup also in this occasion. It's a free stage for me. Okay, so nice. We have one more guest was there, Mr. Karthik. Unfortunately, because the schedule was slightly delayed, he has to move on. So he told just to apologize everyone. So I also see Ajay Arora, there's a different makeover here, the picture and the person, so sorry for that also. Okay. So I'll just give a quick, the topic is the innovations in healthcare, but what I want to say, set the context is here, when I build a healthcare technology company, what challenges I faced. So I think I'll start with that, then we'll put the stage to the innovations and the future of healthcare. So when I was building healthcare, it's, I'll tell you, insanely tough to build. The healthcare startup is very hard. 3 reasons. One, it's 3 people decisions. One, even if patient is having some problem, doctor has to tell to go to surgery or whatever treatment. The doctor can only tell, still the patient has to decide. The hospital is waiting to connect all this dot to get that patient. So there is a 3 people decision is has to come there. Second, a single consumer you take, there is 3 things. One is cash, insurance and EMI. So a consumer who is having insurance alone cannot go the entire journey seamlessly because majority of the areas insurance does not cover. It's only the IPD 24 hours only insurance is going to cover. So most of the areas you have to pay cash. Certain areas if the insurance is not covering, again you have to have a medical loan to cover that treatment. So even if we see in the glorifying medical travel, India is a $9 billion industry. Cross-border patients are flowing to India. But you see a patient who is coming from Middle East or any other country, from planning stage to process stage to OPD stage to IPD and post-surgery stage is still problem. Nobody has fixed it. There is no full stack system in India till now. Nobody has able to solve that. And as a healthcare startup, what I have seen that whatever you want to build in the consumer side, there is no integration with the hospitals. Because the hospital, if you see the largest HIS system, still only have around 4 to 5% of market share. So even if you want to build a consumer-centric product, there is no integration from the hospital side. So I said enough of negative side of what we are struggling to build in healthcare. And if you see, as any of the people are sitting here, I don't think at least only 1 or 2% people will be having a healthcare app in their mobile. That seeing that patient-centric platform, still nobody has really able to crack it. That's the reason all of other apps will be there, flight bookings, hotel bookings, everything will be there. But to know the nearby which center is having an MRI slot available right now, nobody is having option. You have to go to Google, find out the number, you have to call them and check what time the availability is there. So having said this, I just want to say welcome all three panelists. I'm really excited because when I was a kid starting in the healthcare journey, these are the people who are already far ahead of building and proved in the industry. Let's start with Dr. Navin. I worked with Dr. Navin, amazing human being, more than in the healthcare. He proved his career in multiple areas from 40s, US Minister, right now heading the clinical service, and he's personally having family. He's also having hospitals and also invested in startup and also part in the startup journey right now. How do you see, also if you have to add something in the introduction you can add, but how do you see generally the healthcare movement right now? Where are you bullish about right now?
Okay, so just a little bit of introduction about me and adding to what Senu Sam said. I'm a pinhole surgeon. I'm also a healthcare administrator. I serve on the board for a large South-based healthcare organization. And I also mentor startups. To answer your question, where am I bullish on? So I think the future of healthcare, how it looks like a decade from now, it's going to be remote, number one. So we all had this spate of remote teleconsultations that happened during the COVID, and then it sort of tapered off. But then in the future there's going to be even primary care as well as ICUs. Most of it is going to be remote. Even now we have some success stories coming out of the hinterland in central India, where tier 2, tier 3 districts are also putting 10 tele-ICUs and are able to cater to a segment of population which can never make it by road, or even if they have to make it by road to a tier 1 city, it will take them at least half a day. So tele-ICUs, tele-consultations, even tele-pharmacy, anything and everything that reaches you where you are at your doorstep. So remote healthcare, that is something I'm really bullish on. Number 2 is predictive healthcare. Like for example, if I can take a small print out of Senu Sam's finger, I have your genetic makeup, and then I analyze your demography. Senu Sam hails from the south of Kerala, blah blah, and his family history is this, somebody had cancer, somebody had heart disease. Everything is taken into an AI, and then an algorithm sort of spits out. Senu is likely to have a heart block at the age of 55, so Senu needs to do these things starting today. So that is predictive healthcare, whereby genetic information and your demography as well as your healthcare records merge together to create a solution for a problem that you will have in the future. So that is something I'm really bullish about. There are a couple of companies which are already in that space. The second thing, or the third thing that I'm more bullish about that I think is going to be the future is preventative healthcare. Like for example, 20-30 years ago, most people were dying of infectious diseases. The start of the century, we had people dying of cholera, of typhoid, measles, mumps, even COVID for that matter. But then, right now, after the COVID epidemic, if you ask me, what are most people dying out of? It's what we call as NCDs, or non-communicable diseases. Your heart attacks, your diabetes, your cholesterol, your obesity, PCOS, and everything related to hypertension. So these are non-communicable diseases because this can't spread from me to Mr. Pradeep, or not spread from me to Mr. Ajay or to Sam, but then every one of us might have it. So preventative health, and the solution to preventative health is a mixture of lifestyle modifications, a mixture of personalized diet meals and plans, also a mixture of AI assistants or AI nudges that can live in your phone, or a digital twin of you that can reside in the cloud and give you exact day-to-day, hour-to-hour updates as to how to lead your life so you don't suffer non-communicable disease. So this is where I'm looking at, this is where I think the future of healthcare is.
Just adding a question there, Doctor. So you said we have the tele-ICUs and everything. Just one word about the tele-radiology sector and how AI is going to have an impact there.
So AI is revolutionizing radiology for the matter. See, initially AI is, the time of horse carriages, when the motor cars came, everybody thought, their livelihood is at stake. Yeah? So similarly, when ADAS is coming, we think it is initially going to play an assistive role in vehicles. Later on, it's going to play a replacing role. So I think what we should do is we have to understand that the progress of technology is inexorable, and you have to absorb it, make it your friend, make it your ally, and use it to help you on the journey. Radiology, AI has been helping radiologists for the past 20 years. I think we are the very first specialty to actually become AI enabled. So AI assists in diagnosis, AI assists in predictions. If I have 2 lung CTs in front of me, AI right now gives me a 10-second read of it and highlights areas which I have to look at more in detail to pick up cancers. AI is also helping me predict how these cancers may grow to a certain stage or how it is responding to treatment. And eventually there may come a day that even physicians or radiologists may be replaced to an extent by AI. I think if that comes, we will have other roles to explore. It's not like the end of the world. There are always new jobs. When the horse carriage drivers went out of jobs, they became motor car drivers. So there is always a job for humankind. I think we have to embrace technology with respect to radiology and with respect to other things as well. AI is playing a fantastic role. There was a recent study that happened at the Beth Israel Deacon Center where they had 3 cohorts. One was just the physicians, the other was physicians plus AI, the third one was AI alone, and they were given a lot of medical histories, and from there they had to do the diagnosis and rationalize the diagnosis. Can you guess who came out on top? AI scored 95%, physicians plus AI scored 76%, and only physicians scored 75%. Which means AI is already there. AI is in the phase of replacing physicians. So yeah, we got to embrace technology and go forward.
On a funny note, so I see in every area the AI is replacing, specifically on the skilled areas. I was happy that because I just don't have any specific skill. At that time people were laughing at me, so I am very sure that nobody is going to replace what I am doing. So just on a slight note. And I'll come to Mr. Pradeep. I've seen your LinkedIn profile where I'm saying that multiple ventures building in US, specifically focusing on the AI, and it's awesome what you are doing. So I just want to know the other side of the AI. Do you think the India is ready and this gap, the AI can be filled?
Yes, India is ready, just a matter of how fast it is ready. I mean, for a number of reasons. One, if you just look around, we have been doing software and AI quite a bit of time, so a lot of skill around. But most of it, what has been built is for the Western world. You don't see too much of that being applied in India. So I think this is a good opportunity to do that, right? So just to give background of ThinkBio.Ai. So we are California based, but we are strong focus in India, in particular Kerala, which is actually coming together as a backend. So we are working, a number of solutions spanning all the way from research to clinic. So it's a very broad spectrum, we say research to clinic. But we are looking at certain value points where we can go at level. So 3 segments: biotech, pharma R&D, and healthcare, clinical side, precision medicine. So I'll just give some examples on what we're doing, so that explaining the whole concept. So we're working on a number of, we have a recommendation support system, which is already producing results for our partners. That is focusing on multi-specific antibody targets. So which is used for, as labs, as ADCs, as T-cell engagers, multiple ways of doing it. So that's on the biotech side, an example. We are working with the major US, the top 5 US cancer system to build spatialities of human microenvironments using spatial biology as genomics and genomics. So that's another example of the kind of thing we do. We are working with one of the large eye systems in India for on-field solutions for using images. This has been powerful, but on be able to identify diseases based on retinal images using image processing, AI, and then AI, foundation models, all of them. We're working on patient classification systems in UK in particular to help reduce the queues, waiting in the NHS system with partners. So examples like that, practical application of AI. So what matters is being able to fit into the workflow. We are not trying to go to the patients directly, we are enabling the clinicians and the hospitals, that's more important, to give them tools that will improve healthcare for the patients. So precision medicine is the ultimate goal, but personalized medicine is the ultimate goal, or at least get to preventive, predictive, precision medicine at this point. But at some point in the future, get personalized medicine. That's the goal. While doing all this in AI in particular, something to talk about, which is also we're working on, is what is called responsible AI. So as you know, as you use AI, there are multiple issues in play, including classic things you have, hallucinations and mistakes that the models make. Also access to data, privacy, all of that. So we are working on platforms that will stay on top of AI systems as responsible AI monitors, which is important when we apply AI. So that's kind of the range of things, just to brief things that we are doing.
So what you feel the adoption getting slower? So how do you feel that the adoption is faster or slower? I just want to ask.
In India?
In India.
It is slower. For a number of reasons, but I think it's starting to pick up. Doctors are saying, they're doing a lot of great stuff, right? Essentially. So I think when it really matters is that it gets to the next level, you need democratization, more people have access. So the example doctor was giving on the remote care. So that these kind of systems can help improve that. For example, the decision support systems, if you can enable more intelligence on the remote care, that will increase access to patients. So those kind of systems will be very relevant and will be adopted more faster than other systems.
So what I see a lot of technology which is building in healthcare in India, who is going to pay? That's the because nobody wants still India is stuck with the gap of doctors. So to build most of the startups I have seen, they are trying to build and scale to US or Australia or something, because the adoption, getting the money, that's the toughest part.
That's a good point. Even the US, a lot of the earlier stream of the only ones which succeeded is if you are in the payment stream. If insurance is paying for some specific thing. But I think that is changing. It's becoming more of a hygiene factor. So the providers, will find their way for paying it, because it's kind of essential to improve quality of care and maintain quality of care. Right? So if you look at it from that angle, there will be access to the payment customers. So
the question is to Mr. Ajay. So a quick introduction from your side. From my side, I think working in a large corporate and entering to healthcare, when I see your name, first thing I was looking at when we realized I entered to the healthcare system. Then I had a chat with you, I understood that okay, they are building something, the hospital sector they are entering right now, and specifically looking for the middle class people or lower class people. So I think a quick introduction from your side and how you are planning, how your organization is seeing the healthcare right now.
It's on now. Thank you, Senu, and thank you very much for having me on this platform, which is largely related to the healthcare. We have all the experts sitting here. Before I get into the subject, let me try and understand how many people in the audience are actually practicing physicians. By show of hands, if you can show how many of you are practicing physicians or in the healthcare domain. Of course, you are there. And speakers are not counted. So, okay, just a handful of you. And if I understand, but rest of you, all of us, including me, I am also not a practicing physician. Let me tell you that way. Not at all related to healthcare. But all of us, including the people outside of this hall, they are all users of healthcare. We are consumers of healthcare, right? At some point of time, we need some services which are there. So let me try and address it. Going to the so you are my customers. Let me try and address it that way. You know, I come from a background of I'm a graduate in engineering and postgraduate in management. I run factories. I used to be with Maruti Suzuki. Then I used to be with Hero in our businesses. I used to be CEO of one of our businesses. In fact, and that's how it transpired. And Hero is not directly into healthcare. Let me be very candid with you. We are supporting a not-for-profit hospital which is in North India and which is a hugely scalable kind of model. Now what our chairman has a vision is that companies like Hero, Suzuki, Toyota, all these automotive companies, they have literally industrialized the entire manufacturing space of India across the globe as well, not just India. You know, every car or every two-wheeler which is produced is similar in quality within a specified time. Similar thing, industrialization has to be brought in healthcare. Although the pain that I have would be different from you guys, or he would have a different problem. But the service delivery in healthcare has to be standardized. And that's what the industrialization of healthcare services is what we are intending to do. From our not-for-profit hospital, the DMCH, then a medical college and hospital that we have in North India, which is about 1,800 beds, including a medical college and a nursing college. That's what we are trying to support. And as we, of course, people have been talking about technology and how AI can do it. If we look at technology, again coming to the users of healthcare, you know, we go back about 100 years. About 100 years ago, how technology has been changing. We all fly, right? All of us, I don't think so there would be anybody who's not used aviation. Aviation came out over 100 years ago. For aviation services to reach a substantial scale, I would mean about 50 million users, which is about 5 crore users. For aviation to reach 5 crore users took 68 years. For automobiles, all of you use automobiles. For automobiles, it took about 62 years to reach 50 million users, 5 crore users. Then next was the telephone. The telephone, Graham Bell had invented about 80 years ago. About 50 years for 50 million users. The next wave of technology, how technology has been evolving, now we are talking of AI. The next wave of technology was television. Television, computer, cell phone, which is about, so television about 20 years, cell phone about 12, 13 years, right? Internet was about 7 years. And then came the wave of apps. So Facebook was 3 years. Pokemon Go was 19 days. And you know which is the fastest, the one 90 days for reaching 50 million users. And the one which took the lowest time to reach that level of 50 million users. It comes from healthcare. It comes from within India. It is the Arora Setu app. Arora Setu app within 13 days. And it's a homegrown system. Within 13 days, we reached a scale of 50 million. And I'm sure all of you have used it. Is that true? There's nobody who's not touched by Arora Setu and healthcare. This is the strength that we as Indians have. The software services, the technology. I think that is the perspective which has to come in healthcare. And that's where all of us are going to be debating, and that's what we are going to be. And that's what, as Hero, as well as from Apollo hospitals, as well as our other colleague was also talking about, that's how ThinkBio and Senu, all of us, the power of technology in healthcare has to be nourished, and brought in. And that's where you people are going to do it. And we look forward to doing that.
Question is to Dr. Navin. So if some startups want to work on in healthcare right now, what are some problems and opportunities you see they can
Okay.
take it forward?
So, you want me to run the investors camp? Okay. So, I'll tell you, presently what happens is, I'll tell you what the present and the future. Presently, if startups are looking at healthcare, actually find the real problem. Most of the time, the problems are in the mind and it's not in practice. And onboard somebody who's an industry veteran like one of us, or anybody who has been there, felt the juice of the industry, gone through the grind for 20 years, who knows the in and out of the industry. Like you yourself, you started your healthcare startup after how many years in healthcare? 13 years. So nothing can replace that experience. So innovation is good, fast moving is good, nimble is good, agile is good, but it's not a substitute for actual industry knowledge. So get somebody who knows the industry on board, find a real problem, and third, the solution that you get to the problem should not be something that will not work, meaning it should be integrated into the present delivery model of healthcare that is there. Like you think of an exotic problem, an exotic solution, or an exotic solution to an existing problem which cannot be delivered in the present healthcare delivery system that we have. It's not going to work. So for all startups, I think it holds true for most startups in most industries, but healthcare, it holds really true in that these are the points. If you're building something, build it with these tenets. Future. Okay, when I think about the future, there are two things that really excite me. One is reproduction. Okay, I'll tell you why. Do you know the total fertility rate of Kerala? TFR of Kerala. So meaning it is, I think, last I checked, it was about 1.4. Two state ministers, chief ministers, talking about plummeting fertility rates in the south of India. Especially Chandrababu Naidu, to M.K. Stalin, Tamil Nadu and Andhra, it's about 1.7, 1.8, 1.6. What does that mean? It means that what is the common thing that links countries like Taiwan, Japan and South Korea? It's a plummeting fertility rate. Fertility rates and the demography is directly connected with the GDP of a country. If you're going to lose that capital, then how are we going to survive? In China, the fertility rate started plummeting when their per capita income was very, very high. Right now, in India, in many states, this has started plummeting at a point when our per capita income is not even half of what China was. So this has serious repercussions for the growth of India. So I think fertility is the biggest problem. And right now, I am privileged to mentor one of the most exciting startups called Mind and Mom, which is in the fertility space. Padmini Janaki heads that, I think she's somewhere in the crowd. So what I'm looking at as opportunity here is AI and how AI can assist fertility. Can a person, there's a lot of PCOD, there's a lot of endometriosis. Originally, it was 5% of women were all PCOS syndrome. Right now, it's 15%. It's going to be 25% in the next decade. Which means people are not going to be able to conceive. People are not going to be able to have kids. And then the replacement TFR is 2 or 2.1. Right now, at our present TFR is 1.4 in Kerala. Your population is going to continue to dwindle. Where are you going to find the manpower to actually power your industries, power your startups, power your innovation? AI can help to an extent, but you need people, actual people. So, fertility startups, AI in fertility, how AI can help people conceive wrongly, how AI-based personalized medicine and personalized treatment regimes can help them get pregnant faster. These are some things that excite me. The second future, which I think is like really exciting. It gives me goosebumps every time. So, Senu, how would you feel if I told you maybe you can live up to 150 years? Excited? So, Brian Johnson or Elon Musk, all these millionaires, they're looking at launching, right? So, you think sometimes I can sound very futuristic or very foolish when I say that, but you have to remember, at the turn of the century, our life expectancy was 36 years. Right now, it reached the peak of around 74 and then dipped a bit after COVID. But if I told people can live up to 72 at the start of the century, 1900, people would have thought I'm a fool. But you will remember what I'm talking now 10, 50 years from now, because AI and how gene engineering and synthetic bio, like what Mr. Pradeep is doing, is all going to enable humankind to actually live another 10, 20 years more right now. Maybe from a decade, after a decade it will be another 20 or 30 years. Personalized wearables, AI, and then repurposing of previously drugs that act on an mTOR pathways can easily shorten your DNA decay. All these things are going to easily add 10 to 20 years to your life. And because of the plummeting fertility rates, if you can't have children, next thing you'll think is, how longer can I live? So these two things are very exciting and very close to my heart. I am looking at all the healthcare startups that are in this space, and that's going to be the future.
Absolutely right. The facility is another opportunity, especially I know that companies are working there. Not to talk as a different session itself. Just adding one question. A lot of doctors want to become entrepreneurs. And I see wherever I go, even a lot of medical colleges I went to talk, everyone right now want to become entrepreneur. What is your take on it? Just as a light note.
See, I will be the first one to admit that most doctors, including me, start out as dumb. When I say dumb, I mean, everything and anything that is there about patients and our specialty, but we are blind to the world. We don't know what is happening outside the myopic sphere of medicine. So first thing as doctors we have to do is go out, meet more people, and know your numbers. Most doctors don't know numbers. You can't have anything innovative if it is not sustainable or if it is not profitable. So if you're building something, you have to build something not just out of some overnight passion that you got, but something that is actually, having a solution to a problem and something that is profitable and sustainable. So know your numbers and meet more people outside their own sphere of work, and definitely going to get excited by new things. That's entrepreneurship.
I think a lot of doctors is going to come forward.
I think so. Things are changing. I think even today we met a couple of doctors from Mr. Pradeep's. People are actually exploring alternative careers in doctors as well. So future is exciting.
So the question to Mr. Pradeep is that you've been in US for a long time. What's one difference you are seeing compared to India and US? What you're building? What you're building right now? What's the difference you're seeing building from US and building from India?
Right. So I think the biggest difference when you're talking about specifically about software platforms and all that, US has a very mature ecosystem. More obviously it's much more enterprising in terms of business successes and creating known story. Nothing new there, but it's the whole orientation is slightly different. Particularly when you're talking about large-scale solutions, products, platforms, all of that. It's much easier to get the top-level talent to do that. Still a struggle in India, unfortunately, on that level. But for everything else, it's great. So I think that's the biggest difference in terms of building out something, and then so that's something which has to come up. And particularly on the doctor point that you're asking, I mean, I agree. I think doctors are untrained. They cannot do business out of medicine for some reason. But that is changing. Like the doctor was mentioning, and we're seeing a lot more young doctors who are just finishing and willing to go a different route despite the pressure from family and friends. You're not practicing, you're practicing here, do something else, but that is changing. I think that's very critical for the healthcare innovation.
Sir, I still practice. So for doctors, it's also a very passion thing. We can't leave, but it's having the cake and eating it too. That's the thing.
Just to add a question there, you are adopting the AI right now. The clinical pathway.
Sure.
what is the practical future for that, implementing the AI in the B2B side?
Sure. Clinical pathways, mission support and clinical pathways kind of go together. The classic approach was to have all-encompassing mission support systems, which is a tougher bar. So you can use it for things like triage, things like helping. So to give an example, if somebody is dealing with a complex chronic conditions in oncology patient, a doctor will have to spend in the US at least 20 to 30 minutes preparing for a patient, looking at all the charts, all the images, all the things that they have. What some of the systems that we are developing and which is relevant in this context will be, so how do you collate all this data that is across all the different modalities and multimodal imaging, whatever that is involved, and then put it together that is, is visualize it for the clinician, right? So that's another application of and then put it on the pathway, right? So you're going by guidelines, you're going by certain pathways, so essentially put it there easily, so the doctor can make the decision. The clinician make the decision, not the AI, but AI can do a lot of things to help the clinician. So ultimately, the objective is to try to reduce the time the doctor is spending on things that other than talking to the patient, understanding it, and diagnosis and all that. So those are the kind of things that the clinical pathways practically being on right now.
Awesome. So just to take Barman's last question for you. You work with a lot of the government, especially the non-profit organization that you're building for the healthcare side. How bullish you are with the government of India's initiatives and the future of healthcare from that lens, if you are saying?
Good points, In fact, that's something which really needs to be addressed in this gathering. There are three perspectives to the government initiatives in healthcare I must try and address. Any system, any healthcare system or any other system also, there are two or three components, right? One is the infrastructure, the other is people, the third is technology. Anything that you do, whether healthcare or hospitality or transportation. If we talk about healthcare per se, India with a population of about 1.4 billion, 140 crores of us, we have just a little over 1 million beds, which translates to about what? Just one bed per 1,000 people. 1 bed per 1,000 people is less than the WHO prescription, much less than the WHO prescription of 2.5 beds per 1,000 which is there. And which are, and I'm not even comparing it to the developed nations of US or UK. They are lower than countries like, of course, China, Indonesia, Thailand, Brazil, which we are much behind that. And government, and second thing is people, the physicians, like people, Navin is sitting here, there's 1 or 2 physicians here as well. We have, for 1.4 billion people, we just have about 100,000 doctors passing out every year, 1 lakh doctors every year, which has actually, because of government initiatives, 10 years ago it used to be just 49,000. From 49, 50,000, it has almost doubled over the last decade or so, because new government colleges have come, new seats have been added. But still, the number of doctors per 1,000 people is 0.7. 0.7 is much lower than, all these statistics that I'm talking of, even they are in the low-income groups, right? Low-income group countries, which are, in fact, number of doctors, we are not just behind China, Indonesia, South Africa. We are even behind Pakistan. Pakistan is 1 doctor per 1,000 people. A similar holds good for nurses, in terms of nurses. So government is doing a lot to add new beds, new healthcare facilities, the telemedicine which is coming up, the new MBBS colleges are coming up. So a lot is being happening. The second thing which government is doing, and which also actually needs to do much better, the segment that we come from, this segment, what we have been supporting the not-for-profit hospital, DMCH. Not-for-profit hospitals are, okay, not-for-profit means the hospitals between a government hospital. Not many people want to go to a government hospital, right? Not many can afford to go to a private hospital. Private hospitals typically cater to 35% of the total patient load. But not-for-profit, where our OPEX is 90% lower and we don't compete with for-profit hospitals like Apollo or Medanta or all of them. But our OPEX is 90% lower than a private hospital. Our running costs are much lower because we don't have that kind of overheads. We just constitute 2.7% of the total patient load. And that's where government support very much looking forward to for not-for-profit hospitals, because that's the third angle. You know, we don't intend to make money. And for example, if you look at, typically 65% of India's population is in rural areas. Only 22% of our healthcare facilities are there in rural areas to cater to that 65% population. And that's where tier 2, tier 3 cities is where not-for-profit hospitals, the cooperative hospitals, or the charity-based hospital. Within Kerala, you've got a big, Amrita hospital which is there. So we are an equivalent to Amrita in North India, which is DMCH. Third thing which I'm going to talk about, so one is technology, people. The third angle, whatever government can invest in infrastructure or people or anything, what is the best investment that healthcare can be done in healthcare? Any of you, with a show of hands, any best investment in healthcare? Anybody in the panel as well? The best investment in healthcare is something that you have to do it in yourself. Do it in preventive healthcare, my friends. There is a simple rule. Anything that you make, bring AI or .com, and all those things become very complicated to talk about, go down the stage and everything. But there is a simple rule that it's actually proven in Japan. The rule of 10,000 steps. I'm sure all of you must be knowing about that. I have been into a professional field, but I try and run at least 5K every day, something like that. That whatever, even if I'm in the middle of sleep, try and invest in yourself. And that's whatever government can do, nobody can invest in yourself unless you own your health, right? That's what my suggestion, my message to all of you. Thank you.
I just feel concluded. I really love the conversation. I think it's not required only 40 minutes for talking about healthcare. Just to conclude from my side, those who want to build in healthcare, they're not to be sought. The next billion-dollar company will be who is building in healthcare. And please come forward, the doctors who are ready to start. B2C side, the consumer side, the B2B space, or the technological space of AI and all. Amazing. A lot of problems. India is filled with problems, and people want to come forward to solve it. Compared to yours, a lot of solutions, problems are less. So we are blessed with a lot of problems. So please come forward. Every path you take in the healthcare journey, a lot of breaking systems still there. Anything you solve, it is going to be a $1 billion opportunity for you.
So happy to mentor any healthcare startups. Senu's there and sir there. We are always happy to talk to people, try to help you figure out where you want to go. Thanks to the audience from my side, and big thumbs up to Hurdles Global for actually making this a fantastic event.
We want more healthcare founders. I think next coming Hurdle and I think more slots will come for healthcare because that itself is a bigger track to conduct. Thank you once again. I really love it. Thank you.
Certainly. Senu, we request you to present a memento to all three panelists, starting with Mr. Ajay Arora. And Mr. Arora, you had another makeover on the screen just in case you didn't see. On the screen. You're back up. Mr. Ajay Arora. Mr. Pradeep Palazhi. And Dr. Navin Gnanasekaran. To present a memento to our moderator, can I have on stage Mr. Arun G, head of Lead Cohorts with Kerala. And gentlemen, please, yes. We need a group picture with all of you. Please do stand up. one sector which touches every person's life in one way or the other. We just listened to the latest innovations from healthcare technology ecosystem.